Welcome back to Did You Know, a podcast by Partner Veterinary. In this series, we explore all things veterinary medicine and all things partner. In each episode, we answer some of the most common questions that we are asked. From HR to emergencies and everything in between, if it happens at Partner, we'll cover it. Did you know that losing a pet can trigger grief as deep and complex as losing a family member? In this episode, Dr. Melissa Miller, medical oncologist in our Richmond location and pet loss grief specialist, joins us to talk openly about the heartbreak of saying goodbye to a beloved pet. She shares her own journey into grief counseling and offers real, compassionate advice for anyone struggling with loss. Dr. Miller explains why honoring your grief is so important and gives practical tips for remembering your pet, supporting surviving animals, and deciding when or if you're ready for a new companion. Whether you're grieving now or want to understand what pet owners go through, this episode brings comfort, hope, and real answers.
My name is Dr. Melissa Miller. I am a veterinary oncologist by day and also a certified pet grief counselor. And my journey with pet grief actually started with my own cancer pet several years ago. At that time point, I was lucky enough to have a very good support system with my colleagues for when my pet passed, but it became very, very evident that pet grief is not something that was widely recognized. And over the years, it's become more recognized, but we're still not quite where we need to be. And that is where I found that was basically part of my calling. As an oncologist, it is part of my everyday dealing with anticipatory grief. And then, of course, when pets pass, not that every veterinarian doesn't go through that, but even more significantly with end stage pets. And that was kind of my drive to basically pay it forward and become a grief counselor to be able to offer the service not only to my clients, but to other families in the region where I support.
Thank you so much for taking the time to chat with us about this today, Dr. Miller. It is such an important thing. And again, people don't talk about it enough. And it is such a hard thing to go through. And it's hard to prepare yourself for it. How did you become a pet loss grief support specialist? How does one do that?
So there's several recognized programs that are offered. I just did a little research online looking for ones that offered a program that was more veterinary specific, so specifically for healthcare providers. And that's kind of how I got into it. But I've over the years met several grief counselors that have been grief counselors on the human side and either lost a pet or had family and friends that lost pets that, wanted to be more present in the pet world. And then certainly technicians, assistants, other veterinary professionals. There are several different programs that are out there geared towards those types of positions. So there's a lot out there. And I get asked all the time, through veterinary teams, is there a way that they can be more supportive and go through some type of certification themselves?
Your job and the vet techs and, the vet assistants, it's a big job to be there to support the owners when they go through a loss like this. Why is it so important for us to discuss pet loss and the grieving process?
So losing a pet sometimes can be even harder than losing a human family member or friend. And it's something that is the part that is very poorly recognized because it's a different type of grieving process. Not that losing a human, isn't significant, but losing a pets mean something different to a lot of families. And over the years, I've heard every single scenario, families where maybe a pet was the first child that they had. For families that are growing, or maybe that pet is the last remembrance that a person had of their spouse that passed, or another family member that passed, or that got them through a really hard time in their life. That it's a different type of connection, and recognizing that is a different process, than what we go through losing a friend or a family member, that you can talk to, because it's a different connection with a pet where they can't speak. It's a lot of unspoken love, and it's a very different grieving process trying to work through those emotions. And that's where the drive for us to try to guide families a little bit better on how to work through that process, really becomes so important. We don't admittedly get a lot of people skill practice, in veterinary school. And not to anyone's fault. It's just kind of by default, we end up doing it because it is a people business. But it's not something that we get specifically trained for. So, we do our best to help families, but a lot of us get to a certain point and then don't really know where to go from there. And while there's human counselors and grief support of other types, it's not always the same feel going to those counseling groups.
Yeah. So, what are some of the ways that you are able to help families with that process? Are there certain tips that you offer them to help them through the process?
Yeah, and it's really guided depending on the person and how that loss actually happened. Some people benefit from just one-on-one counseling and just talking about their pet. So a lot of times, and that's where I find in the day-to-day with the clients that I see, sometimes just talking about it in the moment, even if it hasn't happened yet, with that anticipatory grief piece, kind of helps them plan how they're going to feel going through the process. Others find that just sharing their stories with others that are going through the same type of process really helps. So I run a grief support group once a month through a local organization in Richmond. And it's wonderful to see because they form bonds between themselves, sharing those stories. And, a lot of it is just intuitive. There's not one size fits all type of counseling plan for those groups. It just a lot of times turns organically into them sharing their experience and what's worked for them, so that people kind of find what works for their own style as far as processing or sharing, between social media or journaling. There's so many different ways that can be outlets, and that's where it really is a personal experience.
And that kind of leads me into my next question. What are some of the ways that you suggest or can offer for people to remember their pets?
Journaling is a huge one. I know that definitely helped me when I lost my own pet. I actually wrote letters to him in the beginning as if he was still there, because it made me feel like he was still very much a presence and I could share what I normally would on a day to day. So it made that emptiness feel not quite so empty in those moments. Photos, a lot of people do, memorials, whether it's a photo album or some type of shrine, so to speak, where you can put those personal items and have a set place to be able to remember them. So very similar to, cremains and a lot of the special items that have developed over the years, something that is specific to them. A lot of people do pet portraits now. That's become very popular over the years, whether painting or those that like to do art, that's a very good outlet to be able to make something that's your own, especially out of items that you have from your pet. So that's become a new thing that some clients have told me that they've started basically crafting, with things that they had from their pet to make it as special as they possibly could.
And crafting is something that can help relieve stress and maybe help heal as well, I imagine, just on a day-to-day. So doing it in conjunction with the loss of a pet, I imagine, could be very helpful. I know I am one to take so many pictures and videos of my pets. My kids actually, who are now in their 20s, say, "You take more pictures of the pets than you do us," which they joke about. But I mean, I've lost several dogs over the years, and I treasure those pictures and videos so much, so it is important to capture that when you can. For people, if you've lost a pet suddenly or tragically, it can be hard to get those images or events out of your mind. Do you have any tips for people when something like that might happen that can help them turn it more into a positive remembrance?
It's one of the hardest things of the grieving process. I've heard from many families over the years that they almost feel like they're still stuck in that moment, physically and mentally, as if it's like Groundhog Day. They're just constantly replaying that moment. And it fades over time, but the immediate, especially if it's been a traumatic experience, it can be very hard to reframe what that looks like. I encourage people, as painful as it can be, to sit with it in the moment, because I find that many times trying to suppress that memory actually can make it worse, because you have to be able to work through it and eventually accept it. But finding the good in the moment, which it takes time. Everybody grieves on their own timeline. Sometimes you have to replay it a couple of times and look at it from different perspectives. Not just the trauma, but almost as if you're hovering over as a separate entity watching the experience, and kind of seeing it from different perspectives. I've encouraged people to try to see it from the perspective of the team that maybe helped that pet, and how they worked with the family and how they comforted and how they experienced it as well. Because we lose sight sometimes. We're in our own grief, and that's totally okay. That's normal response. But we lose sight of the fact that the people around us are also part of that grieving process, and they're there to help support through. So, reframing is one of the biggest things that I work with the groups to kind of learn. And that's for sharing, because a lot of times families have gone not through the same experience, but maybe a similar one, and they can share how they've kind of worked through it. So, it's almost a trickle down effect, and that pay it forward where you learn from others how to let go of that almost negative feeling of it. And remember that even though it was traumatic, everything that we have done and that family did was for that pet, and they were loved unconditionally until that time. And you just have to keep reinforcing the good memories.
Yeah, hard to do, but
Very hard to
yeah,
do.
yeah. You mentioned the team that is helping the pet and the loss that they go through. You guys see it every day, especially, oncology, emergency. I mean, there's always pets coming in that are really, really sick. How do you help, or how do you recommend team members deal with the loss and the grief of having to help these pets, or help end the suffering of these pets and dealing with the families? What can you offer to team members to help them?
I encourage them to give themselves grace, just like I do the families, because it can be extremely challenging from a care perspective, especially for some of the long-term patients, whether they're critical care cases that have been in the hospital for sometimes days, weeks, maybe even months, or chronic patients that we've seen for long periods of time. We build bonds with the families just like we do with the pets, and the loss of that bond where we're not seeing those families, sometimes that's the hardest thing for the team to accept, because it's grown a part of their day-to-day routine. And just like families, they go through the same thing. Reframing that normal routine is sometimes a big challenge as well. So giving yourself grace, that's the biggest thing that I preach. And expressing, if you're having a hard time, it's okay to take a moment. It's absolutely fine to sit with your grief as a caretaker, and cry with the family if you need to, or take a moment and say, I need some time. I can't be near a case similar to this. I've definitely done that several times in my career. I remember shortly after I lost my dog, there was a family that I had treated their pet for a long period of time. And they were ready to let go and say goodbye. And as much as I wanted to be the person to help them, I was very upfront and told them I was there to support them, but I couldn't be that person to facilitate it, because of my own grief. And they understood. People are more understanding than a lot of times we give them credit for, because we want to be cognizant of their grief and not overstep that. But at the same time, they appreciate the honesty. And we have to be honest with ourselves. There's a professional quality of life assessment that I actually take myself once a month. It's geared more towards burnout and compassion fatigue, which a lot of times dealing with chronic grief, or a lot of loss. Unfortunately, oncology, it comes in waves sometimes, where patients are doing well for long periods and then we lose several suddenly. And, sometimes that acuteness can be more burdensome than any, and that helps you kind of get a gauge for yourself of where you are mentally and emotionally to be able to handle those things, and know when to take a break, or when maybe talking to someone, or just going to a grief group. I've had team members that have come to grief groups, even if they haven't lost their own pet, just to feel the same support and hear those stories from families, to help them through their own personal grieving process.
Are there organizations that people can turn to when they have lost a pet? What are some of those organizations? I know you do work with one. Where can people turn to?
So there's a number of different avenues, and sometimes it just depends on what region you're in, what's available. In the Richmond area, and extending into Virginia, Maryland, and the DC area, FetchAcure does offer pet loss groups, both on Zoom meetings for those that are remote, as well as in person in the Richmond area. Many pet aftercare facilities also will usually have resources either on their websites or in their pamphlets, with local groups that they may partner with, or resources online. There's actually a lot of Facebook and Instagram groups and a lot of grief counselors that do post. I came across one when I first moved to Richmond, and we've become very close friends over the years. And she's not based in Virginia. She was actually in Europe for a while, and is now back stateside. But same thing. It's building those connections. So I encourage families, to reach out to their primary care, or a specialist if they've been working with one closely, and see if they have specific resources for that area that they can recommend. Because a lot of times we do, or we're able to ask colleagues that have used, certain groups, depending on what families are looking for. And that's where it just depends. If you're looking for personal counseling or just a group to be able to share, there's actually, I believe now, a Facebook page where families can just post memorials. So it's almost like an online candlelight, which is wonderful. That you can just openly post. It can be anonymous, testimonials of their pets, or just, a brief memorial if it's, their past day, or a special day, to kind of allow them that outlet without feeling like they have to disclose who they are, because a lot of us, people want to be private about it, especially in the initial phases of grief, because it is a traumatic experience. People forget that it's a loss. It's a huge loss. Your body goes through a trauma, just like you would if you had a traumatic, medical procedure, or some type of terrific injury. It's not physical, but it's very much your body feels that same physical stress and that emptiness. So families that tell me, today I could only get up and brush my teeth, that's okay. Every day is a new challenge, and getting through the day and recognizing that your body needs to learn how to live in the new setting. And not that pet will ever be completely gone, but that physical presence is no longer there, and it's something that mentally is very hard to overcome.
Yeah, for sure. And, I mean, pets have such a presence and such a calming presence for us, and that unconditional love, right? And it is just so hard to lose them, and then the silence that follows. That's always been the hardest part for me. Even with other dogs in the home, there's still that void, and that silence, which can be really, really tough. So, and I know we do have on our website, we do have some support groups listed and some websites and stuff. So I will share that in the bottom of this podcast for people who are looking for that. Speaking of other pets, having multiple pets, surviving pets that are in the home. I know when a couple years ago, I've been a multiple dog home for many years, and we had 3 dogs at the time. And in the past, I've never noticed another dog grieving before, but the last loss that we went through, we lost a dog, our oldest girl, just basically from old age in October. And 2 months later, we lost our other dog from cancer. Our remaining dog, he had grown up with these dogs. And it was the saddest thing because he grieved. I've never seen a dog grieve before, and he was just so sad. How do pets mourn? I mean, I don't know if you know anything about this or can shed some light on this, but for people who have existing pets in the home, what do they look for, and how can they help these pets who do recognize that loss?
It depends on the situation. So I know many families, if they have pets that are bonded, so either puppies that grew up together or just pets that grew up at the same time, like you just described, they can't talk to us. But a lot of times just how they behave and their interactions, a lot of families know ahead of time that they may experience a difficult loss, because they're always with that pet. Pets, especially that have separation anxiety and have a bonded buddy in the household, I think probably have the hardest time. Encouraging them, as difficult as it is, families ask me all the time, especially for euthanasia appointments, whether it's in the clinic or if they're having someone come to their home, should the other pet be present? While it's ultimately a personal decision, I did for my own. When I lost, I'm a single dog household now, but when I lost my cancer dog, there were 3 dogs in the house, and they were all very bonded to each other and very similar age. And I made sure that they were part of the process so that they understood when he didn't come home that it wasn't that something terrible was going to happen to them, because they can't tell us how they're feeling. They just act differently sometimes, and some are unfazed. They may have a sense that that loss is going to happen, and they understand, from that intuition between dogs and between cats, and just how animals interact. But some have a harder time because they process probably similarly to people, where they just don't understand what's transpiring in the household. Things that have helped a lot of families, I find cats that are in multi-cat households, for whatever reason, seem to always look for the others. I've encouraged some families to keep mirrors around so that they're seeing reflections, so they feel like there's other pets there. So especially if it's maybe 2 pets and one has passed and the other by themselves, it may be a family that's not ready to bring another pet into the home, for that pet to feel supported. But in the meantime, it gives that sense of, oh, there's someone there. That's helped a lot on the human side with people like amputees, to basically reflect the opposite leg, and almost trick your brain into thinking that it's still there.
Yeah.
Help with that process, and it's kind of a similar feeling for pets, or to leave certain items, things that smell like them, until they recognize, oh, this is where they were. They kind of find their own comfort, just like people do in that same process. So it's hard to know sometimes. We don't truly know at the core how pets grieve, but they definitely go through a process, and just like people, they process it a little bit differently. And sometimes it's just a little bit trial and error of trying to figure out what might work for that pet. I've had some people that have brought their pets, to their counseling sessions, just to get that social support, and that seems to help too. Or taking them to daycare if they've never gone. So same thing, that they have some type of outlet, just like people with support groups. So it's a very similar type of sentiment.
Speaking of adding another pet to the household, is there a right time to do that after you've lost a pet? I imagine that is up to the family to determine when to bring a new pet into the household. But what do you tell people when they have lost a pet about bringing a new pet into the home?
To let their heart guide them, in the simplest terms. I've seen everything from families that were going through anticipatory grief, and had a pet with a chronic illness, and they knew that time was coming, so they wanted to bring a new pet into the home, to help with the transition. And for some, that's the perfect process, especially if it's a situation where they really value how that pet maybe grew up with young children, or someone in the household, or families with elderly family members that maybe have dementia or going through some type of mental situation themselves, to help them with that process, all the way to families that have said, I'm never having another pet, and many go back on that.
Right.
But it takes a much longer time. Myself, it was close to a year before I was ready to welcome another pet. And I knew that I would, but it needed to be the right fit, and I needed my heart to feel right. And sometimes it's a matter of maybe seeing something similar from that lost pet in a new pet that makes it feel like the right fit for that family. That was the situation for me. I joke all the time that I have a mini Blue in Lucky. Blue is my lymphoma dog, and he's a completely different breed. But there's certain personality traits I just knew when I met him, when I was ready to bring a new pet into the home. I met him and immediately just bonded, because he had a lot of the same traits. And I think that's true for many families too. Many families also either foster or volunteer, kind of in that transition period where they want to be around another pet, but they don't want to fully commit to bringing it into their home yet until they're ready to truly 100% open arms, embrace it. And many of them become foster fails. So
I'm one of them.
yeah, I encourage families, if they're not sure, and it can help with the grieving process too, just feeling like you're giving that love. Because again, a lot of times it's the caregiver piece and breaking that routine of, you gave them their meds at this time every day. You kind of felt like it was part of your purpose, and not having that routine can be very, very difficult as part of the grieving process. So having an outlet, whether it's, walking a neighbor's dog or volunteering at a shelter or, being a foster, whatever the scenario is, it generally tends to help because it's not meant to be a replacement, but it helps fill that gap. So that routine feels a little bit more normal over time, and you're doing something in those moments when you would have been with that pet. And it usually brings comfort to a lot of families to do that.
Dr. Miller, thank you so much for taking the time to chat with us about this today. It's such an important piece for so many people who have pets, and I really appreciate you taking the time to chat with us about it.
You're very welcome.
Thank you for listening to Did You Know? Is there something about Partner that you want to know? Email us at letstalk@partnervesc.com. Who knows, we might turn your question into an entire episode. You can now find us wherever you listen to all of your other favorite podcasts. Subscribe now.